Talk to me a bit about some of the strengths during your presidency.
Well, thank you, Jean. Yeah, it is good to be always catch up and to reflect on things and to think about the future. So, you know, uh, I was president during, I was one of the three sort of pandemic presidents, that we had. So I think that the previous history, dating back many years of our leadership, led us to have incredible strengths and such a solid foundation that 2020 was quite a disruptive. I'd like to say if it was positive, it had been a disruptive innovation, but it was really just disruptive. And so the strengths of the academy, having such strong leadership, such a good foundation in strategic planning, such a solid financial, footing, having the kind of structure where we could pivot, was an incredible strength. And then, of course, just the work that we do, being interdisciplinary and working with patients, with serious illness is an incredible strength because it's so needed. And we were on and still are on a growth trajectory. So, lots of strengths. I think we also sort of proved to be more resilient than we had probably been, challenged with in the past. And our board really, rose to the challenge. So yeah, lots of strengths that I think helped us carry through. Again, the leadership, the solid, stewardship of the resources, the membership, and the mission of what we do.
And maybe the staff too.
And the staff. That's what I meant, the foundation. I consider that when I say foundation, I mean the staff, absolutely.
Yeah,
If you
wonderful.
think about it, during that year, we were coming into the first year of a new strategic plan, the first year that our board had broadened to include, non-physician members, and a new CEO, which we had not had in, 13, 15 years. So a lot of excitement around change, and then we were disrupted.
Yeah. So I'm hearing that sort of the strong foundation, the mission, what we do, what we're all about, and of course the people, and as well as actually some opportunities with there being change, since it was kind of a time of disruption, but always turning, sounds like you found a way to turn those into opportunities.
Well, I think we did. And with the leadership, again, being challenged in a way, we had to look for opportunities. Obviously, we had to look for opportunities to support the field in the clinical front line of what we were doing. We had to find opportunities, a way to deliver care, like the entire nation, every part of medicine, to deliver care remotely and through telehealth. So that rapidly accelerated, what we could do. I think we had to find opportunities in diversifying our revenue streams because we had, relied a lot as an academy on our annual assembly, which was, our sentinel event and sentinel part of our revenue stream. And for 3 years, we didn't get to have a live in-person, meeting. So there were opportunities. And I think there was an opportunity for us to also bring the element of to talk about resilience more in, because we were, for our other colleagues, for our colleagues that had never really seen suffering quite in the face like we had before. So many of our teams, I think, came together to help their colleagues and other, specialties and things.
Do you think those experiences, or in what way do you think those experiences strengthened us for the future, not just during your presidency?
No, I hope so, because it was such a, trauma, but sometimes, of course, trauma, you heal and hope, but hopefully you don't, forget, and hopefully you took something, away from it. I know that I personally took more of a commitment to resiliency or to self-care, away from it, and boundaries and boundaries.
So so important. It's so easy to get
Yeah.
sucked into everything. talk about, so you've talked a lot about the strengths. What about threats? Do you see, or what do you see as threats to the academy?
I think the real threats to the academy probably just reflect some of the threats to uh, what's happening in healthcare, and in our, in our field, rising costs of, medications, increased scrutiny or of just all, technologies, medications, increasing workforce, challenges. Our field is obviously not immune to, shortages of nurses, doctors, all members of, the interdisciplinary team. I think that we have some work to do as a field and a healthcare system around end of life care in different settings, like hospice, like the nursing home settings, extended care settings. I think we still need increased commitment to research dollars and education, centers of excellence in palliative care. And even though we've been working on it and trying to get Pachita across the finish line for over a decade, it seems like, we get inch a little bit, closer. So those are some of the things. I think that, the opioid, crisis always continues to challenge different parts of the United States differently. And I think that increasing diversity, all types of diversity in our, field are challenges. So those are challenges in big picture. I think the academy, sort of reflects that, in a lot of ways.
Mm-hmm. And as you think about the future of AHPM, and we're going into strategic planning soon, um, where do you see that you think the greatest opportunities for AHPM going into the future?
I think some of the greatest opportunities are continuing to partner with other organizations that have similar, goals and challenges around healthcare delivery. I think that's one of the big, opportunities. I think continuing another opportunity is to just continue to step forward and be, advocates for, things like, diversity and taking, equitable care, health equity. It's not just at end of life or for advanced illness, but further upstream. I think there's an unbelievable opportunity in trying to upstream supportive care even more than what we have done. I think that's the future is, patients spend the vast majority of their healthcare journey not in hospitals and not in doctor's offices. And so we need to be there, more. So I think those are wonderful, opportunities for the academy and thinking interdisciplinary and bringing more specialization of different disciplines, along the way, not just physicians or APPs.
And I'm curious if you have particular thoughts about what things that the academy itself can do to further these areas.
Well, I think, the academy has a strong history of being sort of that home or that place of networking and place of tribe, so to speak, for, physicians and for its members. I think we can always continue to try to be the home for advancing knowledge, also. So partnering with, other organizations and really promoting the research and advancement of knowledge. I definitely think the academy can also be a place of, for education, for education of, again, interdisciplinary and maybe focused on interdisciplinary, more. The academy has had a, a long history, I think, of being a collaborator, as evidenced by some of the, grants and things that we partnered on, in the past. Maybe taking that to the next, the next level.
Wonderful. Well, thanks, Rodney. I think your perspectives and your wisdom are so timely, and with deep gratitude as one pandemic president to another pandemic president.
Right.
Yeah, I can resonate with your experiences, and really appreciate you sharing your thoughts of where the opportunities are and how we as AHPM can really be diving into these and embracing them and taking the field forward to achieve what it is we're here for in the first place, which is to, care for people with serious illness and their families. So thank you so much for your time.
Thank you. It's always a pleasure to catch up and to think, to reflect and to think about the future.